But let's stay with issues of health, right? And talk hypertension now. It's been dubbed the silent killer. And the silent killer, that is hypertension, affecting a staggering percentage of our population, with over 80% of hypertensive South Africans having dangerously uncontrolled blood pressure, significantly exceeding the global average of 31.1%. So I'm joined by Millicent Mashele, who is living with hypertension, and also by dietitian Moloko Mehlape. Good afternoon, and thank you for your time. I'm seeing confused looks on your faces. Let's talk about hypertension. There's a reason why it's called the silent killer, isn't there?
Definitely, and thank you so much, and good afternoon to the viewers. So my hypertension came through during pregnancy. I then had 3 pregnancies, and then one of the pregnancy was actually we lost the baby because it was not managed. So because the doctor and myself, my history, I didn't know that I had hypertension. But when you are pregnant, there is a chance and there is high risk that you'll develop hypertension. So in that note, you'll find that my baby was actually, I have to give birth early, like 26 weeks. And then we couldn't save her life because we were not aware. And then the 2 pregnancies that came after, all the babies were also born early. The other one, yes, the other one was 31 weeks. And I have to stay in hospital for a prolonged time before I give birth. And the other one was born at 26 weeks. And after giving birth, I have to stay there for like 2 weeks to ensure that they manage and ensure that my high blood goes back to a managed situation. Yeah. And the babies also stays in NICU for long. So it really reflects that even as women, when we fall pregnant, we need to understand that there is that disease. Yeah. But post-pregnancy, I then have chronic high blood, which is actually something that I live with, manage and monitor. Sometimes you feel like, okay, maybe I'm fine, but you're not fine because it's a silent sickness. Yeah. And sometimes we just feel like you're okay, especially when you work in a high-pressured roles like myself.
Dr. Mmabatswa, you work in the space, you are an obstetrician and gynecologist. How common is this experience of hypertension presenting during pregnancy?
Good afternoon to you, Thulasizwe, and good afternoon to the viewers. Hypertension in pregnancy is very common. It affects around 10% of pregnant women worldwide, and it's also one of the leading maternal cause of death and a leading cause of neonatal death. So it is a very silent condition, and sometimes you are not aware that you have it until you go to a health professional to check your blood pressure.
Yeah. Let's bring in dietitian Moloko Mehlape just to weigh in, joining us on the line. Moloko, good afternoon to you as well. Just talk to us about the lifestyle elements that, in a way, when not managed properly, can exacerbate hypertension, but when managed properly, can help a person to cope. What are some of those that we should be aware of this afternoon?
Good afternoon to Lasizwe and the viewers. So when it comes to hypertension, we manage 3 things. When it comes to the diet, the first thing would be your salt intake. So if we minimize our salt intake, then we are going to be able to reduce and manage high blood pressure. And salt, we're just not talking about the table salt. There are hidden sources of salt in most foods. One of them is the processed food. During the processing of food, they add salt to inhibit the bacterial growth. So when we are consuming processed foods, we are increasing our intake of salt. One of the hidden sources of salt would be your packet soups and your stocks, and also your spices. So when we are seasoning food, we try to encourage people to use things like your herbs, your parsley, your mixed herbs, your paprikas, instead of adding 4 different types of salts in one pot. The other thing would be reducing the fat intake, avoiding avoiding fried foods, and also avoiding saturated fat that is mostly found in red meat. So we encourage the intake of fish and chicken and our bean family.
All right, I've got to leave it there, unfortunately, because of time. That's Moloko Mehlape, who is a dietitian. And in studio, I was joined by Millicent Mashele, who is living with hypertension, as well as Dr. Rogers Mmabatswa. Unfortunately, time not on our side on this World Hypertension Day. So we do hope that we've given you enough of a sense of some of the issues that you should be aware of.